So today we are joined with Kevin Kelly. I'm June Tinsley, Head of Communications with NCBI, and I'm joined today with our very own Kevin Kelly, NCBI's Head of Advocacy, to chat to us about the whole issue around social distancing now that it is becoming the new normal, and as the country begins to emerge from our lockdown. It's really important to highlight the challenges that social distancing can pose and what people who are blind and visually impaired can do about it, and more importantly, what the public and government can do about it as well. So thanks very much, Kevin, for joining us today.
No problem at all, Jin.
I suppose we'll kick off. As Head of Advocacy, you're obviously in touch with many of our service users. And what are you hearing on the ground as the challenges with social distancing?
I think for everyone, COVID-19 has caused everyone to do things differently, and it's presented lots of different challenges for people. But I think people who are blind and vision impaired are really feeling the effects of the government restrictions in two ways. First being the loss or the perceived loss of tactile feedback, and then the impossible task of physical or social distancing.
And I suppose, what are you hearing are the experiences to date of people who are blind and visually impaired?
I think for some people who are blind and vision impaired who have been going out and respecting the rules and going out for walks, the streets in rural areas have been quite quiet. But for others, they've had really negative experiences when they're out and about, whether that be going to the shop or going to the pharmacy, or just going about their very simple daily activities that everyone else would take for granted, where there are members of the public passing negative comments to them about, oh, you're invading my space, you shouldn't be there, why are you not respecting the rules, making comments about their guide dogs, and the guide dog perhaps passing on COVID-19, which is completely untrue and not based on any scientific evidence. So all of that is coming together and making it really challenging for people who are blind and vision impaired, making them really anxious. And I suppose NCBI have been drawing attention to this topic in the last number of weeks, and are going to be continuing to do so, because it is an issue that is unfortunately going to be with us for quite some time to come.
And I suppose, Kevin, just from your own personal experience, going out and about in the suburbs of Dublin, have you experienced any negative comments or any positive reactions towards people to support you?
Yeah, it's a mixed bag. I think if you're known in your locality, people will speak to you. But in areas when you get further away from your base, it becomes more challenging. I'm a predominantly a guide dog user, and I have used the cane over the last couple of weeks to get a true sense of what it is like for people who are using that method to get around. And the experiences are similar but different, because the dog is trained to avoid obstacles, and he will avoid people, and so on and so forth. He unfortunately is unable to detect whether he's 2 meters, or is unable to obey a queuing system, but it is somewhat more easy. However, with the cane, the very purpose of the cane is to identify obstacles by hitting them with the cane. So that means that you end up inevitably on top of people, quite literally, before you know it, and they're in their space. And there's anxiety not alone in the blind and vision impaired community, but there's an anxiousness and a nervousness in the general population, because we've been listening to public information rightly about needing to obey the rules and respect hygiene and all of the restrictions. So people are on edge out there at the moment, and it's conspiring to make it very difficult and sometimes a very negative experience for people who are blind and vision impaired.
That's true. And I suppose the other thing that's true is that of the 54,000 people who are blind or visually impaired, many of those either do not have a guide dog or do not use a cane. So I suppose there's issues there where people might not realise that an individual does have a visual impairment. And I suppose, what do you think the public can do to support people who are blind and visually impaired?
Yeah, well, I suppose there's two answers to that, and it's not all about the public. People who are blind and vision impaired, and particularly people with low vision, have a responsibility to make the general public, make it easier for the general public rather to identify themselves as someone who is living with low vision by carrying a white cane or a symbol cane. And I know some people don't feel comfortable doing that, but it would be the strong recommendation of NCBI to do so during this period, because if you're somebody with low vision and you're not easily identifiable, it's very hard for the public to grant you and afford you the extra space that you require. I suppose moving on to the general public and what they can do to help and support people who are blind and vision impaired at this time is to always allow them 2 meters. The onus is on the public to provide the 2 meters space, because someone who is blind and vision impaired cannot do so. We would also ask the general public to identify themselves before offering assistance. They should never grab someone thinking that they are doing right, because that can be very negative for people who are blind and vision impaired. So always identify yourself before offering assistance. And many people who are blind and vision impaired will welcome that assistance. Others will say, no, you're okay. I don't need the assistance at this moment. And thank you very much for asking. So the key is always to ask. And then at this particular time, we would recommend that you offer verbal direction as the form of assistance that you offer.
Perfect, I suppose, and they're very practical tips as well for the public to assist people to abide by social distancing for their own benefit and for those who are blind and visually impaired. Um, and I suppose you mentioned there what the public can do, what people who are blind and visually impaired do. But what about kind of public health officials and the Department of Health? What must they do?
Yeah. NCBI have been engaging with the Department of Health, the HSE, and government officials and ministers in the last few weeks to draw their attention to the challenges that facing people who are blind and vision impaired. Unfortunately, my own view is that public health officials have been quite slow to realise the significant challenges that are facing people who are blind and vision impaired. NCBI will continue to do everything in our power to raise this issue in the media, but I do think there's a need for the government and the government information services to produce literature and information to the general public, recognising the significant challenges that are facing people who are blind and vision impaired, to make as many people aware in the public of the challenge, because I think if we get the message out there and it's across the board, it will make it easier for people who are blind and vision impaired, because I think it's really sad and disappointing. And I was speaking to our group of advocates yesterday, and there was a lot of articles and coverage in mainstream media yesterday about, oh, isn't it great that the restrictions are easing and there was a spring in everyone's step. But for the group of advocates that I was speaking to yesterday, their anxiety and their nervousness was growing, because they realised that the streets and the paths are going to become busier, and it's going to make it a very negative experience for them when they are out and about doing their simple tasks. So I think the government needs to do more to make people aware of the challenges and what people can do to assist.
And connected with that, Kevin, is obviously some proposed plans to extend street furniture of shops and cafes and bars out onto the footpaths in order to ensure that those cafes and bars can abide by social distancing, without realizing that by doing that, it poses further challenges for people who are blind and visually impaired to navigate safely.
Yes, you're quite correct, June. This idea of creating more space in the public realm is really a double-edged sword for people who are blind and vision impaired, because on the surface of it, removing people from the footpath and for them to walk in the bus lane or in the road makes it easier and makes the path less crowded, which is something that many people who are blind and vision impaired would welcome. Where the picture becomes muddier and more complicated is the idea that there will be businesses and cafes having street furniture outside their premises. And I think people who are blind and vision impaired, the majority of them realize that we're in the midst of a national crisis, and steps have to be taken, but that has to be done in consultation. It has to be applied in common sense. There are simply streets where it is not appropriate or possible to have chairs and tables for people to dine at. So our fear and the fear of NCBI would be that this potentially could undo some of the great work that has been done in this area by local authorities to declutter our streets. And in fact, on an annual basis, we run our Clear Our Paths campaign, and we also partner with the DFI on their Make Way Day. So there needs to be consultation with key stakeholders, disability groups and people with disabilities to ensure that the interim measures that are put in place don't disproportionately affect people who are blind and vision impaired and the broader disability community.
Very much so, especially when we know social distancing is here to stay for the foreseeable future. So I suppose it's a question of making sure that all sectors of society are involved in making that as practicable as possible for us all to live in harmony and safely to ensure the eradication of COVID-19.
Yeah, we hear a lot of discussion around how the country has come together, and we came together as a country to prevent the disease taking hold during the lockdown phase. And this is the phase now where it's going to be much more challenging to keep that social cohesion and people together. And the only way to do that is to engage and have conversations to make sure that we don't leave anyone behind. And I thought it was interesting. I've heard an ad on the radio and on the TV in the last couple of weeks where the government and the information services are talking about not wanting to leave anyone behind now as we reopen the country. But I think without sustained and a structure for consultation, there's a real risk that people with disabilities will be left behind.
And that's something obviously NCBI and many others are going to ensure it doesn't happen, to make sure that people, as I said, work together to make sure social distancing can work for everybody. I suppose, is there any other issues, Kevin, you'd like to highlight before we let you go?
No, I just would say to people who are listening to this who are blind and vision impaired is to get in contact with NCBI through our social media channels, rather, and get in contact with the policy and advocacy team if you identify issues and challenges that are arising as a result of COVID, or generally, because we do want to hear from you. We are here to represent you if you choose to be represented by us. So we want to hear from you, and we are here to help, and hopefully there will be positive developments in the next few days coming back from the government, and that they will realise the significant challenges that are facing people who are blind and vision impaired.
Fair point. And I suppose just to remind listeners that the NCBI helpline is 1850 33 43 53, and that helpline is manned Monday to Friday 8 a.m. to 8 p.m. And it's the best way to kind of connect to access different services, as well as the policy and advocacy team. So Kevin, without further ado, I would just like to say thanks very much for taking the time to discuss the importance of social distancing and what we collectively can do to support people who are blind or visually impaired.
You're welcome, Jen, no problem.
Great, thanks very much. Bye.
Thanks.